Hey, it's Shane with GotRom.com. This video is about an email that I get every couple of months, which is basically, I just had hip surgery, but I haven't regained all of my function, or I'm still in pain, or, this is the worst case scenario, sometimes I get an email saying I had hip surgery and things are worse now. And the question comes, can I do the FAI Fix program? And the answer is, of course, yes. And the reason why is because surgery only kind of takes care of one aspect of hip pain, hip function, which is the shape of your bones, what's going on with your labrum, and anything going on with like cysts or bony deformities in your hip. But that's only one of what I think are 5 main players in hip pain and hip function, and the FAI Fix addresses the other 4. So what are the other 4? We have tissue texture, tissue length, tissue strength, and motor control. So what are those? I want to break those down a little bit. Tissue texture. If you've never done anything, if you've never heard of foam rolling, then basically tissue texture is using self-massage, going way beyond foam rolling, but starting with a foam roller usually, self-massage to restore the texture and pliability of your tissues. So a lot of people have the misconception that they just kind of can go throughout life without really addressing the softness or suppleness of their muscles, and they think if I just stay physically active, then I won't have any pain. And that has not been my experience or the experience of people that I work with. I actually think that throughout your entire life, you should have some kind of a self-massage practice, in addition to a stretching practice, in addition to a strengthening practice. You need a complete movement practice. So we teach in the FAI Fix how to use what we call very targeted tissue work to go beyond just kind of bluntly rolling objects on you, to get into areas where you might have scar tissue in your hips, areas where maybe you have an old injury, an old strain, or you just have never massaged that area at all, so that you get all the deepest, darkest corners of your hip soft and supple. And when that happens, very often people experience that their pain goes away. So if you've had surgery but you haven't been doing tissue work, I'm going to invite you to start doing deep targeted tissue work. I'm also going to invite you to start doing some kind of stretching practice and some kind of strengthening practice. Often those actually can go hand in hand. So a lot of people will stretch, for example, and they won't have any kind of an active strengthening component to their stretching. So for example, if I'm stretching my hamstring, they just kind of lean forward and breathe and relax, and then call it a day. And in the FAI Fix, we teach you that yes, you have to lengthen the hamstrings on the backside, but you also have to strengthen the muscles on the front so that you have a balanced hip joint. You've got strength on the front and length on the back. Goes for inside, outside, all the way around the hip. You need an optimal combination of length and strength. And the last component in the 5 components of hip health, which is motor control. How much body awareness and control do you have of your hip joint and your pelvis in all planes of motion in all directions? And to develop that kind of motor control, you start with very isolated exercises, like what I was just doing, some kind of like isolated strengthening, or isolated strengthening, or isolated like this. And then you integrate it into more complex movement patterns, like say squatting motion, or picking things up. Do you know what a proper position is to squat, to lunge, to walk, to run? All the yoga poses that you might be doing. There's a proper technique to almost anything that you do in life. There's optimal biomechanics, and there's suboptimal biomechanics. So if you haven't been addressing these other 4 components, and you got the surgery and it didn't give you the results that you wanted, I invite you to, of course, come do the FAI Fix program, but definitely address tissue texture, length, strength, and motor control to have overall healthy, happy hips. So give it a shot.
Yeah, be cool, just